everybody, in this neuroscience tutorial question and answer, let's start with question number 1. An 8-year-old boy has fallen off of a jungle gym onto a hard surface and has been rendered unconscious. When he arrives at the emergency department, he is still unconscious, is bleeding from his nose, but has only minor facial abrasions. Which of the following imaging studies would give you the most immediate and relevant information regarding the condition of this patient? A. CT, B. PET scan, C. T1 MRI, D. T2 MRI, A. X-ray. The correct answer is A. CT scan, because it is fast, economical, and most importantly for the case, can immediately identify life-threatening conditions such as skull fracture and or acute blood in or around the brain. The second choice is false, because PET scan, which stands for positron emission tomography, uses intravenous injection of isotopes of fluorine, ethane, deoxyglucose to measure relative metabolism within the brain. PET scan measure metabolic activity, but provides a little or no anatomical detail. And while it may provide information on certain neurological disease, like as neurodegenerative disease, epilepsy, certain tumor, it is not a standard testing procedure, especially in emergency. MRI, on the other hand, is slower, can be frightening for some patient who has a claustrophobia, especially with long time period and the noise of the machine, which is a common problem, especially if the patient is conscious and not clearly identify bone fracture or blood compared to CT, and CT is less sensitive to patient movement than MRI, and that's a good point. A major advantage of CT is that it is able to image bone, soft tissue, and blood vessels all at the same time. But MRI provides much more soft tissue detail than CT. That's a great point. Note that on MRI T1 image fat is white. On MRI T2 images both fat and water are white. The bone cortex is black. It gives off no signals on either T2 or T1 images because it contains no free protons. At the last, X-ray would provide information only on the bone fracture. Question number 2. A 32-year-old woman calls your office and says that she has been violently throwing up, vomiting, for several hours. Which of the following would describe this woman's condition at this particular time in the course of her illness? A. A deficit. B. A sign only. C. Sign and symptoms. A. Symptom only. E. Apnea. The correct answer is D. A symptom only. because the woman calls and describes a problem that she is experiencing herself, which is a symptom. But you as a physician cannot examine, discover, or evaluate this problem on this patient at this time. When you can do so, it then becomes a sign, something you witness and evaluate. So, symptom is any subjective evidence of a disease, like headache, while a sign is any objective evidence of a disease, like high blood pressure. If both the patient and doctor notice something like rash, it can be classed as both a sign and a symptom. On the other hand, a deficit or focal neurological deficits are focal CNS signs due to impairments of the nerve, spinal cord, or brain function that affects specific region of the body. Weakness in the left arm, the right leg, paralysis, or plegia. Generally regarded as a condition resulting from a lesion or disease process, such as head trauma, tumor, or stroke, or by various diseases such as meningitis or encephalitis, or as a side effect of certain medication such as those used as anesthesia. Apnea is a process in breathing or period of shallow breathing, mainly during sleep. Each pause can last for a few seconds to a few minutes, and they happen many times a night, and the cause may be obstructive, central, or mixed. Question number 3. A 75-year-old woman presents at the emergency department after losing consciousness at a family picnic. The examination reveals a loss of pinprick sensation on the right upper and lower extremities, a diminution of discriminative touch on the right lower extremity, uncoordinated gait, and weakness of facial muscle on the left. Taking all of these woman deficits into account, which of the following stands out as the best localizing in this case? A. Sensory loss of both extremities. B. Sensory loss on lower extremities. C. Sensory loss of upper extremities. D. Uncoordinated gait. E. Weakness of the facial muscles. The correct answer is E, i.e. weakness of the facial muscle, because localizing signs are essentially a comparison of all deficits in particular situation to see which specific deficit may best indicate the probable location of the lesion. The weakness of the facial muscle on the left in combination with long tract sign localize the lesion to either the facial muscles or the root and somewhere in the brain stem close to these structures. In combination to long tract signs, it specifies a lesion in the brain stem alternating or crossed deficits. In this case, it specifies a lesion in the caudal bones on the left side, but sensory loss on the extremities and uncoordinated gait may result from lesions at many different levels of CNS. However, inserting a facial weakness in the equation provides a clear answer. Note that initial hypothesis, all symptoms result from a focal lesion at one location. Subsequent hypothesis, if symptoms are bilateral and distributed over many body segments, consider multifocal, e.g. multiple sclerosis, or diffuse, e.g. metabolic toxic amyotrophic lateral sclerosis disorder. Brainstem lesions are characterized by presence of the cranial nerve deficits, mix of the multiple sensory system deficits, or motor and sensory deficits, all on the opposite side of the body. Internuclear ophthalmoplegia, long tract symptoms. In this case, the gait difficulties may relate to the lower extremities loss of discriminative touch, in which case it is called sensory ataxia. Question number 4. A 23-year-old man is brought to emergency department from an accident site. The examination reveals that he is profoundly weak on his right side, has a loss of vibratory sense on the right side of his body, and doesn't feel pinprick on the left side of his body. The cranial nerve examination is normal. He is oriented as to time and place, and he is well aware of his situation. The lesion in this patient is most likely located in which of the following: A. diencephalon, B. metencephalon, C. mesencephalon, D. myelencephalon, E. spinal cord. The correct answer is A. spinal cord. This case illustrates one general and important concept concerning regional localization of lesions. This patient has alternating sensory losses, one sensory deficit on the right side, another sensory deficit on the left side, significant motor deficit on one side, and no cranial nerve deficits. This particular combination of problems, i.e. alternating sensory plus motor plus no cranial nerves, is characteristic of a lesion in the spinal cord. Lesions in the diencephalon or diencephalon plus telencephalon may give rise to motor and all sensory deficits on the same side of the body. Brainstem lesion usually present as alternating or crossed deficits. Cranial nerve deficit on one side and long tract deficit, frequently the corticospinal on the opposite side. So, don't forget, spinal cord lesion characterized by 1. Deficits that fit a dermatomal distribution that start at specific dermatome and include all the dermatomes below. 2. Loss of the tactile sensation or pain and temperature for the body only, i.e. cranial nerve are normal. 3. Loss of the tactile sensation on one side of the body and pain and temperature on the opposite side of the body. Brown-Sequard syndrome. 4. Weakness, paralysis on one side of the body and loss of the pain and temperature on the opposite side of the body. Brown-Sequard syndrome 2. 5. Suspended sensory loss of pain and temperature bilaterally with dermatomes above and below the affected area normal, e.g. syringomyelia. 6. Long Tracts symptoms, dorsal columns, ALS, pupillary dilation, corticospinal. The diencephalon is the thalamus mainly, the metencephalon is the pons, and the cerebellum mainly. The mesencephalon is the midbrain mainly, the myelencephalon or afterbrain is the medulla oblongata. Don't forget that. Question number 5. An 8-year-old boy is brought to the emergency department with 2 severe bites on his left hand. The history provided by the mother reveals that the boy was playing in his yard and a squirrel approached the boy. When the boy attempted to pet the squirrel, it attacked the boy's hand and viciously bit him. The physician suspected that the squirrel had rabies. If left untreated, which of the following would be likely progression of this disease? A. Anterograde transport of the viruses, eventual degradation, only local infection. B. Anterograde transport of the viruses, replication in axon terminals, systemic distribution. C. No transport of viruses, only local infection, treatable with local antibiotic. D. Retrograde transport of viruses, replication in cell body, systemic distribution. E. Retrograde transport of viruses, eventual degradation, only local infection. The correct answer is D. Retrograde transport of viruses, replication in cell body, systemic distribution. Because rabies viruses uses the method of retrograde transport, the active movement transport of substances or particles from distal part of the neuron terminals proximally toward the cell bodies of the neuron. Once in the cell body, these viruses replicate, are shed, got rid of by the neuron, and are subsequently taken up by other axons that terminate on the cell bodies or in the immediate vicinity of the shed viruses. By this mechanism, the disease is spread in the body, become generalized disease. On the other hand, once a rabies infection is established, there is no effective treatment, so antibiotic has no role, but animals vaccination and post-exposure prophylaxis protocol are highly effective. Anterograde transport is the movement of substance from cell body of the neuron distally to the axon terminals of the neurons, but this type of transport doesn't take place in rabies, unlike herpes simplex virus.